We are good to go.
Well, good afternoon and happy Friday to everyone that was able to join us on this wonderful topic of equity and Black lactation with Tamika Jackson Dyer. We're really excited to come together and we're going to highlight some of the significance, challenges, and support systems around supporting Black Breastfeeding Week. We hope the discussion will help initiate a meaningful conversation and drive positive changes in support of Black Breastfeeding Week and the broader goal of breastfeeding equity. So I am going to turn it over to our wonderful speaker, who's going to give us a brief introduction. She's a woman of many, many, many hats. So I will kick it over to her and then we will start with some questions, but we also welcome people to come off mute and join us if they also have questions, as well as the chat. Go ahead, Tamika.
Good afternoon, everybody. I am Tamika Jackson Dyer. I'm an IBCLC, which is an international board certified lactation consultant. I also hold several other lactation certifications. I'm a CLE, CLS, and CLC, which means I'm a certified lactation educator, specialist, and counselor. I'm also a CHW, which is a community health worker. I recently took a doula training and um, a mental health um, first aider, which means I can assist with mental health support as well. I am here today as a member of the Starting Five, one of SIMI's co-founders, Southeast Michigan IBCLCs of Color. I also have a private practice, Crazy Milk Lady Lactation Support Services, and I am very happy to discuss equity in Black lactation today, reducing racial disparities in human milk feeding. So the biggest question we get always is, let me move this box, it's in the way. Bam. Why do we need Black breastfeeding? Because, well, we'll get into that later. But Black Breastfeeding Week was founded in 2014 by three Black women. Interestingly enough, none of them are lactation supporters by trade. That is not their actual job, none of them. One of them is in maternal infant nursing. One is a journalist, and the other one is a teacher who started a local breastfeeding support group for Black moms here in Detroit. The journalist is from New York, and I can't remember where the nurse is from, but they got together 10 years ago and decided that because of the major disparities in Black breastfeeding initiation, duration, exclusivity, and a lot of the other issues that we'll get into in a second, that we needed to have a fully focused week that was part of Breastfeeding Awareness Month, which is the national celebration, which is modeled after World Breastfeeding Week, which is obviously the international celebration, to focus on Black breastfeeding. So when Black Breastfeeding Week started back in 2014, the CDC data showed that 75% of white women had ever breastfed versus 58.9% of Black women. So that was a 16% gap. And it's insane to think that, almost more than 40% of Black babies were not receiving any human milk back in 2014. And so that gap had stood for over 40 years. So I know one of the questions that came up was how has Black breastfeeding helped? Like, has it changed anything? Well, as of 2022, according to the CDC data, 75.4% of non-Hispanic Black infants are ever breastfed now, compared to where it was in 2014, which was 58.9. However, the actual gap between initiation or ever breastfeeding for Black babies and white babies actually widened during the 10 years. So even though more Black women are breastfeeding now than were 10 years ago, everybody is breastfeeding more. So white women were doing 75%. Now they're at 92.7%, which means the gap is now at 17% instead of 16%. And so we're still trying to figure out how to close that gap. And there are a lot of different programs and community work going on to make that happen. So one of the one of the biggest reasons why we need Black Breastfeeding Week to address the incredibly high infant mortality rate for Black babies. So nationally, the rate is about double that of white infants. Here in Michigan, I know for a fact in Detroit, there are certain zip codes where the rate is 4 times higher for Black babies to not make it to their first birthday compared to white babies. And that is absolutely unacceptable. So we know that one of the main reasons why the infant mortality rate is so high is because Black babies tend to be born too small, too soon, and they're very sick because of that. But if we increased the rate of women who breastfed these babies to help build their immune systems, to like I tell my clients, if your body didn't finish growing on the inside, your will finish on the outside. And so to give those babies that chance to have access to their mother's milk or to human milk, we could definitely decrease those rates. We know that babies who are fed, preemies particularly, who receive human milk, have much better survival rates and are usually discharged from the NICU much sooner than babies who do not receive human milk. They also are less likely to succumb to one of the major illnesses that kills preemie babies, and that's necrotizing enterocolitis, which you may have heard of, because right now there are several class action lawsuits going on against formula companies because they have known that their product contributes to increases in the rate of this disease for at least 20 years, and they have not made that information known. So now folks are suing. And so if we could get more Black women to breastfeed, we could cut these infant mortality rates. Let's see. High rates of diet-related disease. Soul food may be good for the soul, but it is not always great for the body. And so a lot of what is considered to be soul food, because you can make it healthier. But traditionally, it was based on the diets of enslaved people who had to make do with the scraps that they were given. And they were able to turn what was essentially trash food into something that was nourishing and filling to take care of their families. However, what that contributed to was high rates of type 2 diabetes, obesity, high blood pressure, gout, like all these things that are now seen as Black diseases, a lot of times are actually related to the traditional diet that has been in place for generations. So when you look at what the first food or what should be the first food, what breast milk can do to alleviate a lot of these things, because we know that when you breastfeed, you reduce the risk of type 2 diabetes, obesity, high blood pressure, even asthma. And for the lactating parent, it reduces risk of heart disease. It helps you lose your postpartum weight faster. So of course it helps you avoid obesity because you're not layering all the fat from all the childbearing on top of itself. So if we increase the rates of breastfeeding, we know that we can reduce the rates of these other things. It's very, very simple. Breastfeeding is very foundational to fixing a lot of the problems that we see in healthcare that are often thought to be intractable, or just it's how they eat, or it's because of whatever. Blackness is not the issue, race is not the issue, racism is the issue. We'll get into that in a second. Number 3, this is why SEMI exists. SEMI exists because of number 3, which is lack of diversity in the lactation field. So there's major disparities in the rates of breastfeeding. There's also major disparities in the rates of breastfeeding supporters. When I got into this field 15 years ago as a breastfeeding peer counselor for WIC Works, shout out to WIC, what I saw was that there were a lot of breastfeeding peer counselors that looked like me. But when I needed to refer a client somewhere else or needed higher level of care, there was nobody who looked like me. When I started, I want to say there were three IBCLCs, three Black IBCLCs in the state of Michigan, in the state of Michigan, not in the city of Detroit, in the entire state. And one of them was a trainer for WIC. That's how I met her. And the other one was a lactation consultant at one of the busiest birthing hospitals in the state at Hutzel. And she'd been there forever. She was actually a lactation consultant when I had my firstborn, who was almost 23. So it was really discouraging to go to, well, it could have been discouraging to go to these trainings, to see these people up on the dais and not a single round face, right? And so that was my motivation. I'm like, okay, I like doing this thing and I want to go higher, right? And so a lot of the members of SEMI felt the same way. It was like, hey, I'm out here, I'm doing this work. I know what it's like to be a mama who needs help and really want somebody who understands me and comes from where I come from, where I don't have to explain all these extra layers, and get the help that I need. And so that's actually why I wore this shirt today. I don't know if you can read it, but it says very rare. So as a Black IBCLC, I am very rare. There's only about 3% of the practicing IBCLCs in the country who identify as Black or African American. So when you look at the fact that Black folks make up about 14% of the country, that's kind of a problem. Especially when you look at what IBLC, which is the body that certifies lactation consultants, says that lactation care should be culturally congruent, that you should have so many lactation consultants for so many birthing folks. That means that the number of Black lactation consultants in the state of Michigan right now, which I believe hovers around like 22, 25, is somewhere in there because we just had a whole group of folks that passed the test not too long ago. But there should be that many Black lactation consultants serving in Detroit area hospitals alone. And I'm talking about the whole state has that many. And it is definitely a barrier to care because if I have my mother in law telling me that she doesn't want me doing that slave stuff with my baby, do I want to tell a white woman that? If I've felt disempowered or not listened to, and the white nurse just came in the room and grabbed my breast and shoved it into my baby's mouth without asking if she could touch me, without thinking about the compounded generational trauma of not having full autonomy of my body in the presence of whiteness, how does that affect my breastfeeding journey? And so making sure that we have more Black and brown lactation consultants to assist families is really important. Plus, we don't walk into the room with the misconception of Black women don't breastfeed, because we know they do, because we did, right? We did, our little cousins did because they saw us do it, our mamas may have. And so a lot of times the statistic that I related that, Black women are less likely to breastfeed, that's the one stat that I have found most non-Black lactation supporters, they know that statistic. They might not know any of the reasons contributing to it, but they know that Black women don't breastfeed as much. And so they come into the room with that preconception. And so how does that affect their care? Right? It's like, oh, well, she's probably not going to keep going anyway because they never breastfeed more than a week or two. And I have 10 other dyads on the floor. So do I really want to waste my time going in there to help her? Oh, well, her grandma and her auntie are in there. They can handle it. She doesn't really need my help. But nobody in the family breastfed for 4 generations, though. Grandma and auntie can handle it. I've been assumed to be the auntie in the room when I'm the working lactation consultant on the floor, by my white colleagues who literally once came in the room while I had a baby in my hands, about to latch him to his mother's breast, and she snatched the baby out of my hands because the doctor wanted to do the circumcision right there. Oh, mom, grandma, we'll be, no, ma'am, no, ma'am, please look at my badge. I'm working here. And so those kinds of micro and macroaggressions and the lack of folks who reflect the people that they're serving really does impact the rates of breastfeeding initiation, duration, and exclusivity. So having people who are, and I hate the phrase culturally competent, culturally humble is a better phrase, and who are willing to look at their own biases and what they heard and what they think in order to serve families in the way that they need to be served is one way to make sure that more Black mamas are able to breastfeed. And the unique cultural barriers. Like I mentioned, slavery. Slavery was a major, major issue that has caused generational trauma. And Black breast milk built this nation. So it's crazy to me that we don't breastfeed our babies, right? People hear that who aren't in this field, and they're like, well, didn't Black women wet nurse? Like, weren't they the ones who? Yes. And that's why a lot of them don't do it now because I have control over my body now. Nobody can tell me how I'm supposed to use my breast or what I'm supposed to do. So I'm just not going to do it. And which, in a backwards way, it is taking back your power, but you are hurting your baby in the process and yourself. Um, so we know that, especially in this country, there are lots of booby traps for everyone, right? We don't have maternity leave standardized across the country. We don't have breastfeeding friendly spaces everywhere. We don't have access to lactation support that is affordable or because just because something exists does not mean that it's accessible. So having, oh, you have this lactation consultant, but she charges $350 for a home visit, and you're on maternity leave, but it's unpaid because you worked just long enough to get in under FMLA. That was my situation when I had my first baby. Like I just squeaked by there before my daughter was born. But I'm not making any money and I need help. And so what do? Well, I mean, they keep sending formula to my house. They keep mailing me these coupons. When I go to Meijer and I swipe the baby registry of the pump that somebody sent me, they print out Enfamil coupons on my receipt. Well, maybe that's what I should do. So when you look at those barriers, plus you add in the fact that Black women are more likely to go back to work sooner than everyone else. I've had clients who had to go back to work within 10 days. And I mean like physical jobs within 10 days of delivering a baby. They're less likely to have a job that has the flexibility of, switching to part-time or being able to take your breaks, which now, thanks to the law, more people do have access. But, we know people break the law in jobs all the time, right? And so just because it's illegal to do a thing doesn't mean that they're not going to do it anyway. And if you are like the sole breadwinner, or you're not going to risk rocking the boat and potentially losing your job just to breastfeed, even if it's something you really, really want to do. Or if you work in a job where, you're by yourself all day, think about gas stations, right? I had a client who worked at a gas station. She would be solo for 12 hours a day. When is she supposed to pump? So thinking of all those kinds of things, plus the lack of social and family support, because for generations, nobody in the family breastfed. My big mom, my great grandmother, she did not, because that was the generation where the folk squads were being used to get Black women to use formula. And so if you had money, and my granddad worked in the plant, he was part of the Great Migration. He came up here to work for Ford, where they was making, $5 a day. And that was, that was an amazing amount of money. And so they weren't wealthy, but you didn't want to look poor, right? You didn't want people to think that you had to breastfeed because you couldn't afford this great new product that was on the shelves. Only country folks did that. We up north now. We don't do that. And so they tricked an entire generation of women from running away from what had culturally been the norm to this new, better living through science was like the tagline on a lot of things. And so then my grandmother did not breastfeed because now she's part of the generation that women are getting into the workforce. And women are able to get divorced. And so now she's a single mom with 2 kids and she's going to school and she's working. Ain't nobody got to have to breastfeed, right? Okay. So then my mom comes and it's the 70s and black is beautiful and black power and black pride and let's get back to nature and let's be natural. But society hadn't caught up. So she had to go back to work when I was 4 or 5 weeks old. There were no fabulous double electric hospital grade pumps back in the 70s. There was, she did it for as long as she could, and then she had to go back to work. And so then there's me. And I'm like, okay, I'm reading all the things, I'm looking at the stuff, I'm educated, and yeah, I want to try this. I want to do this thing. And I was blessed to have a family who didn't push back just because they didn't do it, right? They're like, oh, okay, well, you read the stuff and you gonna do this? Okay, all right. So I actually had support, and then I sought out support from my daycare provider because that is a major pothole for folks a lot of times. If your daycare provider or your babysitter is not on board, and you have to go back to work and you can't afford daycare. So auntie is watching the baby or granny is watching the baby. Then that's a barrier that we don't address or think about. And so the multi-generational support that a lot of us are missing contributes to the fact that we're not able to. And I am proud to say that I've started a breastfeeding tradition in my family, right? So like my little cousins saw me breastfeeding my kids and they're like, oh, okay. So then when they started having babies, they're like, okay, well, I'm gonna try this breastfeeding thing. And so now I have this whole generation of little cousins that have been breastfed because I was willing to say, we got to stop this. Too many folks got high blood pressure. It's too much. That's not normal. We didn't turn out okay. I formula fed you and it's okay. No, what is okay? What is okay? Everybody got the sugar. That's not okay. Right? Big Mama had to have her leg amputated, and all the little babies got asthma. And are we okay? Are we really okay? So looking at those things and denormalizing what has become normalized and saying just because something is common does not mean it is normal. And having folks look at it in a different way, being able to be the role model for these folks coming up. I can't even tell you how many people, and we got a nurse in public, y'all. I need to put that out there right now. It's hip to nip, okay? You have to nurse in public because the kids, if they don't see it, they're not going to do it. I was grown before I ever saw anybody breastfeed. And I thought it was weird. I was like 20, maybe. And I'm like, what is she doing? We're in a restaurant. Not thinking, we eating while the baby can't eat, right? And so, making sure that you are encouraging them. You don't have to, yes, if you want to cover up whatever, but you have to do it so that we can make it normal again. Because it is the biological norm, but we have to normalize it sociologically as well. And desert-like conditions in our community. Kimberly Seals Allers, one of the co-founders of Black Breastfeeding Week, actually coined the term first food desert. A food desert was something that has been discussed in sociology for a long time. And it's basically somewhere, a community where there is no access to fresh, healthy foods, right? You don't have grocery stores, you only have party stores, liquor stores, a Dollar General. You can't get fresh fruits and vegetables. You don't have access to good meat, things of that nature. And so a first food desert, according to Kimberly Seals Allers, is somewhere where it's not possible or very, very difficult for someone to provide that first food of human milk to their baby because they don't have access to skilled lactation support. They don't have access to even the education prenatally to tell them why they should breastfeed. They don't have the support in the community. There are no, I don't think I've ever seen a little Lecce League group in my neighborhood, you know? So all of these things work together to cause issues with folks being able to breastfeed, even if they want to. And then you add in, you know, the lack of support. If you can get access, they don't look like you. They don't understand the issues that you're coming in there with. We know that Black babies in the hospital are 9 times more likely to be offered formula than white babies, even when the mother says she wants to breastfeed. And I know this from personal experience. I'm very lucky that with my first, I had a nurse, a Black nurse, who heard me say that I wanted to breastfeed. She heard me talking to my mom and my sister. And so when my daughter came, she was like, all right, let's get started. Never saw a lactation consultant while I was in the hospital. Never got a lactation referral, even though I asked. But that nurse latched my baby and got me on the pathway. With my son, I literally had the nurse manager in my room trying to convince me that I needed to give him formula. Ma'am, I do not. And I will not, right? But if I had been a first-time mom who didn't know what I knew, who hadn't already successfully breastfed a baby, who wasn't as strong-willed and loud as I am, then I would have said, okay, because you know, she's a nurse, she knows. She works in the hospital, she knows. And so making sure that people have access to skilled, culturally humble, or culturally congruent lactation support is very, very important. You cannot expect people to meet these goals set out by the AAP, exclusive breastfeeding for 6 months, continue breastfeeding for 2 years, if they don't have any support. This is not, breastfeeding is a biological phenomenon. I'm sorry, lactation is a biological phenomenon, but breastfeeding is a sociological. And so if you do not have that social support, those mommy support groups, the lactation consultant, the, you know, the partners getting educated. Shout out to Reggie Reg works here as the fatherhood coordinator. He's also head of fatherhood initiatives for Semi and husband of one of our co-founders. He's actually a trained certified lactation consultant. I'm sorry, certified lactation counselor, because he knows how important it is for him as a dad who is involved in the raising of his children to know about how his children eat from the very beginning. And so having that support for daddies, making sure that grandma is educated and made a part of the process. You know, where were you at when I was having kids? You know, I wish I had knew these things when I was having babies. They never told us this stuff. And so making sure that we are watering the land so it's not a desert anymore, so that people have access to the things that they need to be successful. Because in the long run, we are making sure that the health of generations is impacted. And do we want it to be a negative impact or a positive impact? And lastly, because we said so. That's why Black Breastfeeding Week exists, because we said we need it. And so we created it. It is for us, by us. And yes, we love our allies and we need your support, but this is for us because we know we need it and we know what we need better than anybody else. So that answers the question, a bunch of the questions of why do we need Black Breastfeeding Week. So if you want to, I'm going to stop sharing now and you can ask any of the questions because I can't see if there's anything in the chat that we have set out.
And feel free if anybody wants to come off mute and they have their own questions or want to pop up them in the chat. But Tamika, how can healthcare providers advocate for systemic changes that support breastfeeding equity?
Oh, goodness. First, by being educated on what the issues are. Because, like I said, most of them know what the statistic is, but they don't necessarily know the things behind it. And education is the key. And then sharing that with their colleagues. It's great if you know it, Dr. So and so, but please tell Nurse Mary what you know. Please inform anesthesiologist Joey all the things that you learn. Let Mr. OB become aware of why he needs to make sure that his patients are receiving prenatal breastfeeding education. One of the things that we found is that, white coat syndrome, people listen to doctors. They listen to the doctor, often sometimes, well, in this particular case, often to the detriment of themselves and their babies. And even when there's a lactation consultant or a nurse or anybody else, family member telling them something different. Um, yes, it is hip to nip. And I didn't make that up, but we did that. Oh my goodness, a million years ago when I was still a WIC breastfeeding peer counselor. It was a presentation that we did. It was very fun. I wish I could find that video. But making sure that the providers, even if they don't feel comfortable on their level of education, literally, if they say breastfeeding is important, you should give it a try. Like that can increase initiation. I used to work in a clinic where the doctor, like he asked me, he's like, well, I don't know what to say. Just tell them it's important and that they should listen to the lactation consultant when she comes in. And so he literally would just go in the room and be like, so you planning to breastfeed? Well, as your doctor, breastfeeding is important. And I'm like, yeah, you did it. So it just making sure that they are, and if you don't have the expertise, just like they do with anything else, refer to the experts. That's one of the hardest things to get them to do.
Hip to the nip. Definitely gonna work that one in there. Are there successful examples of community-based initiatives that have improved breastfeeding rates among Black mothers that you can share with us?
Yes. So, SIMI, okay. SIMI exists, and we are definitely improving rates in our city and surrounding areas, not just in the city. We serve Tri County. But if I think about something specific, the proliferation of Black breastfeeding support groups. Like I mentioned, I'd never seen a Leche League. I'd never even heard of it, really, until I got into this field. But making it so that sisters are supporting sisters again, like we used to do back in the day, whereas it doesn't even have to be something majorly formal, but the groups that have popped up that are specifically safe places for Black mamas, it definitely makes a difference in the outcomes. I think about the support group I was in, which was not specifically for Black moms. It just ended up being that. But our lactation consultant was actually, she was Italian. She was an Italian lady married to a Latino, and loved her, Linda. And she worked out of the hospital, which, almost 90% of folks who delivered there were Black. And so we had this group of mommies, and she just gave us the space to be together. And of course, she was there if we had clinical questions, anything that was majorly wrong. But just being able to gather with other mommies who were doing the same thing, who looked like me, whose babies were, who had the same struggles, what my mama said, or his daddy's mother keeps doing blah blah blah. My auntie is always trying to, and then being able to support each other through that. I know all of us nursed well into toddlerhood, and like none of our families had done it. And so that definitely has created space for things to get better.
Again, if you want to come off mute, feel free. Please, if you have any questions, drop them in the chat as well as available. And if you have any resources, please feel free to drop them in the chat. Would love us to be able to share and collaborate other resources with one another. But Tamika, are there any targeted programs or resources in place to support Black mothers who want to breastfeed in Michigan?
So I was actually a part of the steering committee on a WK Kellogg funded grant, shout out to Kellogg, that worked with my former employer, Cofactive, under a project called QI Tracks, which was quality improvement through resources and community supports. And it was specifically focused on reducing racial disparities in breastfeeding rates by working with birthing hospitals in the state. And so we could not get the UP hospitals to join us, and we tried. We tried for a long time. But we were able to get 7 hospitals across the state, from the top of the UP all the way down to Detroit, east and west, to join us on this journey. And the focus was on baby friendly, getting the hospitals onto the baby friendly pathway, but with a very specific racial equity lens. Our goal was to reduce the disparities in 3 main categories, which was initiation, exclusivity, and duration. And so we partnered with community organizers in each of the spaces who partnered with their hospital, so that folks could have prenatal support, in hospital support, and post discharge support. Because we know that once you get home with this baby, you need help. And so I am very, very proud of the work we were able to do. It was a 3-year grant. And we were able to achieve major reduction in disparities across the 3 areas of focus. So the initiation disparity in our partner hospitals was reduced by 48%. So the gap that was between white initiation and Black initiation was cut by 48%. Exclusivity, because we know that if you are not exclusive in the hospital, you will likely not meet your breastfeeding goals. Excuse me. We cut that disparity by 41.5%. And then the disparity in access to post-discharge support, because remember, just because something exists does not mean it is accessible. And so there were programs in a lot of these spaces where, they're like, oh, well, but don't nobody want to come back to the hospital where y'all treated them wrong, having their baby to get help with breastfeeding. Nobody wants to come back to where the nurses violate their bodily autonomy by grabbing their breast without asking and shoving their baby's face into their chest. Nobody wants to come back. Where the doctors didn't listen when they said they were in pain. Linda was I didn't know that, Samira. Linda was the best. She actually, I'm getting off topic, but she was, when I went for my first certification, she was the professional who wrote my referral letter. So yeah, Linda Rodriguez, she was my lactation consultant with the boy. But we were able to cut the disparity in access to post-discharge support by a third. So we made major moves with that project, and it showed that if you focus on the least of these, which is what one of my teammates, Lanius Gilmore, used to always point out, then everybody gets help, because the breastfeeding initiation, exclusivity, and duration went up, period, hospital wide, right? But we were able to cut these disparities. And it created an offshoot project called the Warm Referral Network, which right now is in the city of Detroit, but we're trying to expand it to Grand Rapids, where doulas and midwives and lactation consultants and mental health providers are available for referral, so that these folks get post-discharge support. Because like what you and I talked about the other day, Sarah, we know that mental health, breastfeeding, all the things go together. And so if I'm struggling with breastfeeding, it's definitely going to affect my mental health. And so if I can get lactation support, that's going to reduce my mental health concerns. If I have a postpartum doula who can come out to the house and feed me while I feed this baby, that's definitely going to help my duration. And so that project definitely has made a big difference. And we're hoping to be able to get further funding so we can expand it.
You mentioned community resources and what other policy changes? Again, we mentioned community, we were talking about resources, but what policy changes are needed to support Black breastfeeding mothers more effectively? And again, I heard some shout out to Reginald. I'm going to support, pop in his support group among others, but feel free to put anything else in the chat. But yeah, what policy changes that you might recommend?
Yeah, we need policy changes across the board for all mamas, but a rising tide lifts all ships. So if we could get, where people have access to actual maternity leave, people have access to real access to skilled lactation care, because yes, the Affordable Care Act made it part of the law, but insurance companies is real funny with how they want to actually apply that law. The fact that I am out of network, or most of my colleagues are out of network with every single insurance company, is absolutely insane. And so it's like, okay, yes, we have this coverage and you can get this, but then when a client comes to get it, oh, well, no, you can't see her because she's not in. Well, who is in? Well, you can log onto your computer and talk to this lady in New York for 30 minutes. But no, nobody can actually come and help you hands on with breastfeeding. So actually enforcing those parts of the ACA, I don't know how policy would need to change for that to happen. And then also making Medicaid cover lactation support. Because the ones who need it the most, and I want to be very clear, I am not correlating Blackness with poverty because they are not the same thing. But we do know that a very large population of folks, a very large population of Black folks do qualify for Medicaid. And so if I have Medicaid, I want to be able to have access to the same services and supports as somebody with private insurance, because I deserve that too. And so Medicaid not providing lactation support and then paying out these billions of dollars to cover, asthma resources and breast cancer, because Black women are more likely to have breast cancer that is more aggressive, more deadly, and get it at younger ages. And we know that breastfeeding reduces the risk of that. All these resources that they're spending on obesity prevention and diabetes, just put it into breastfeeding, put it into lactation. And you will see a major return on your dollars, because that's really all they care about. The bottom line is money, right? And so, well, you can get that if you do this, but they just can't seem to wrap their heads around it some kind of way. And Samira on Fridays.
I'm literally trying to get the picture to populate. It won't upload. We might have to do it the old-fashioned way. I'll put the link here in the chat. Is it Joe? Did you want to come? Did you have a question? I see a hand raised.
Yeah, I'm sorry. Can you hear me okay?
Yeah, we can hear you.
Hey, I just want to say thank you, Tamika. That was a wonderful presentation, and I admire the things that Simi has done. I'm from Chicago, and I met you guys, and I love hearing what you're doing. What we know is policy is important, and I'm bragging on Illinois. One thing they've done in the last couple of weeks is our governor signed a bill where doulas, IBCLCs, lactation consultants, CLSs will be able to be paid through Medicaid. That just went through. Don't know how much, but it's coming. And I just really admire the things you're doing. And I'm working with a group of doulas and providers to try and start mentoring and do a program in the community. And my last question is that slide that you had with the Black mom breastfeeding in front of that flag. I would love to use that in a presentation that I do with them, to kind of like, why is it important that they look at becoming, some people are trying to figure, do I want to do the CLS thing? Do I want to do the IBCLC? So I'm trying to give that presentation, and that would be a wonderful slide to add to remind them of why we need to be more supportive. So thank you. I loved your presentation.
Okay, I gotta see if I can find the name of it, but I can put it in the chat. Or
Yeah, and I'll give credit. And even your nip, I'm sorry, I'm using it. I heard it from you. So whoever you got it from, let them know I heard it from you, and I love it. Thank you for sharing that.
okay.
Hip to nip.
So it's not gonna let me upload those images, but you got the links and you can check it out for more information. You can come on down and see Tamika in person and Smira and Mycia on our team there for the free lactation services, as well as some other links. And if you got them, drop them. We'd love to share them. As we wrap up this beautiful Friday afternoon, Tamika, how can we continue to support Black breastfeeding? We continue to grow and evolve in Michigan to meet the needs of our Black mothers in the future. So what can we do?
Nature's Playhouse is doing it right now. We need our allies to shout it out. We are screaming it from the mountaintops, but a lot of times the spaces that we're in, we're preaching to the choir. We need more folks of more non-melanated folks to be aware of the issues and the problems, because so often we get, why do we need Black breastfeeding week? Why do they get a week? Or, well, don't all moms need breastfeeding help? Or doesn't everybody know you're supposed to breastfeed? Why does it have to be specifically that? And again, education is the key. So usually Simi will run like a whole series during the week on our social media. And we'll get, we always get some stupid comments, but we will get people who are like, oh, wow, I didn't know. Like, I was not aware. It doesn't even, it never even occurred to me that something that happened way back when, and so it was really not that long ago, would still be affecting families now. Or, I didn't know that nurses don't just come and help you breastfeed your baby. I mean, because when I had my babies, that's what they did. But yeah, but the lady down the hall from you didn't get that same care. And so you need to use your privilege and your voice to lift that up. And when you see something, say something. I love me a loud ally. Somebody who says, wait a minute, would you didn't say that to me. You didn't treat her like that. Why are you? Because folks operate in implicit bias, which means they don't even realize a lot of times that they're doing it. When that nurse walks into the Black mom's room and leaves the 4-pack of Similac bottles on the counter, even though on her chart she says she wants to breastfeed, but you see that she's given a formula feeding. And instead of referring her to lactation because latch hurts, baby sleepy, whatever, you just, and you don't even say, like, oh, give them this instead. You just leave it on the counter and walk out. Yeah. One of the many, many reasons why I don't work in the hospital anymore. Yeah, so way too much of that. But yeah, if we had more support from folks who were not, because this work is hard and it's heavy. And when you are supporting folks, and you also need support yourself, getting some help from the outside makes the work, many hands make the work light. So yeah.
So true, so true. I want to say, thank you to our community partners, Sempwick, for helping us be able to host this workshop, among others. Also United Way, Southeastern Michigan. Shout out to Semi, our community partner, and a big, big, big thank you to you, Tamika, for all that you're doing for the families. And again, like, share, get the word out. And we hope to see y'all soon. All right. We'll see you later. Anybody's got any last thank yous for
Thank
Tamika today?
you.
Thank you. Thank you.